When we talk about breast health, and we talk about cancer in general maybe, and risk of cancer, there is one observation that I've made from all of the scientific research that I've done, particularly in the arena of nutrition and nutritional medicine, which happens to be a special interest of mine. And that is that there clearly is an impact on disease risk from the amount of plant nutrients or phytonutrients that we put into our system. What do I mean by that? That cancer, heart disease, stroke, diabetes, high blood pressure, osteoporosis, to name just a few. Aging is not really a disease, but there is a published association. That we can significantly reduce the risk of these major disease processes simply by increasing the amount of plant foods that we take into our diet, i.e. fruit and vegetables. And this is well published. There's lots of published, peer-reviewed scientific data that supports that simple notion. So the simple concept of 5 a day is a much more significant message than most of us think. We all know it, but in fact less than 10% of the UK population is eating 5 portions of fruit and vegetables a day. So clearly, although we acknowledge it, we're not actually translating that into our lifestyles. Now, for me as a physician and as a scientist, knowing what I know about the impact of phytonutrients on disease risk, and we have to include breast cancer in that, clearly one of the simplest things that we can do to impact on our risk is to take more plant nutrients in. It's as simple as that. That message needs to be endorsed, it needs to be rubber stamped, it needs to be preached from the hilltops, and doctors need to get involved with empowering their own patients to making these simple lifestyle changes so they don't need their doctor's help in the long run. This is one of the simple ways that we can change disease risk, and it's very pertinent to our discussion about breast cancer risk.